Many women wonder how long they need to continue with routine pap smear screenings. It is a common question, and the good news is that for many, there does come a time when regular cervical cancer screenings can safely stop. Imagine gaining peace of mind, knowing you are still protected but no longer need this specific test. This is often the case for individuals who meet certain criteria, allowing for a thoughtful discussion with their healthcare provider. The simple answer is that you can often stop getting pap smears around age 65, but only if you have had consistently normal results for many years and no history of serious cervical abnormalities. This guideline is not arbitrary but is based on extensive research into cervical cancer risk and progression, which shows a significantly lower likelihood of developing new cervical changes after a certain age, particularly when past screenings have been clear. It is about balancing the benefits of continued screening with potential discomfort and the very low risk of finding anything significant. The primary reasons for being able to stop screening revolve around age, a consistent history of negative or normal pap and human papillomavirus, or HPV, test results, and sometimes a complete hysterectomy. For those over 65, if you have had 3 consecutive normal pap tests or 2 consecutive normal coat tests, which means both a pap and HPV test, within the last 10 years, with the most recent test occurring in the past 5 years, you may be eligible. If you have had a total hysterectomy for non-cancerous reasons, meaning your cervix was removed, you also typically no longer need pap smears because there is no cervix left to screen for cancer. However, if your hysterectomy was due to cervical cancer or precancer, continued screening might still be necessary. To determine if you can safely stop your pap smear screenings, the most important step is to have an open conversation with your healthcare provider. Your doctor will review your complete medical history, including the dates and results of all your previous pap tests and HPV tests, and consider any risk factors you might have, such as a history of cervical dysplasia or a weakened immune system. They can explain the current screening guidelines in detail and assess how they apply specifically to your health profile. Do not make this decision on your own. Always seek professional medical advice. It is fascinating to note how screening methods have evolved, moving from just pap smears to often including HPV coat testing, which detects the virus that causes nearly all cervical cancers. This dual testing provides a more accurate picture of risk, as persistent HPV infection is the key driver of precancerous changes. While HPV infections are very common and often clear on their own within 1 to 2 years, sustained high-risk HPV presence is what medical professionals look for. This advanced understanding allows for more precise recommendations on when to continue or discontinue screening, ensuring you get the right care at the right time. Ultimately, understanding the factors that allow for stopping pap smears empowers you to make informed decisions about your ongoing health management in collaboration with your doctor. It highlights how personalized medicine uses your unique health history to guide your care, reducing unnecessary tests while maintaining robust protection against cervical cancer. This proactive approach ensures your peace of mind and continued well-being, focusing on the most effective strategies for your health journey.